Hi, everyone. Welcome to what promises to be an insightful and forward-looking conversation with Dr. Ann Treviño. This interview will be on select aspects of GLP-1 medications, including Dr. Treviño's insights around trends, challenges, and opportunities. Dr. Treviño is a highly esteemed senior medical director here at Lyric, working with internal and external stakeholders in the area of claims editing and medical coding. Before joining Lyric, Dr. Treviño served as a senior medical director for pharmacy utilization management at Oscar Health. There, she led a team of medical directors, collaborated cross-departmentally, and chaired the Pharmacy and Therapeutics Committee, significantly contributing to the optimization of pharmaceutical reviews and policy development. Dr. Treviño's extensive experience also includes key roles at Aetna, Humana, Cotiviti Healthcare, and United Healthcare, where she excelled in medical policy creation, post-claim review, and payment accuracy. And her innovative approach has led to substantial cost savings and operational efficiencies across various healthcare segments. Dr. Treviño, it is a privilege and a pleasure to have you with us today. Really appreciate you making the time and looking forward to hearing your valuable insights.
Well, thank you, Steve. I'm happy to be here today.
Your expertise and personal experiences make you the perfect person to dive deep into this topic. So let's start with a bit of your personal journey, if we could, Dr. Treviño. You have professional and personal experience with GLP-1 medications. So what are some of them, and then how have they helped shape your passion and overall thoughts for these medications?
Before GLPs came on hot on the market, I really didn't know much about them. But in my time at Oscar, we noticed, obviously, an increasing trend in request for the medications. Add that to the fact that I have family members who are diabetics who were prescribed these medications and noticed what they, as patients, were having to go through in obtaining the medications for treatment of their diabetes. And what we saw at Oscar, Oscar is a small health plan on the exchange. We saw, obviously, requests all day, every day for these medications. Being on the exchange, there were certain states that required use or approval of medications for weight loss. Obviously, they're approved for diabetes. But then there's also lots of off-label uses for these medications. The bulk of what we saw at Oscar were either off-label indications or actually what we did find were, unfortunately, providers who were giving misinformation about the request for the use of the medication. So they would say that the patient was diabetic. However, in looking at patient history, both through pharmaceutical claims and through medical claims, we found that the patient was not diabetic. They were, in fact, either overweight or obese. And so in seeing that information, it was very disheartening to see that there would be healthcare providers who would actually fudge information in trying to get the medications approved. And so that was disheartening. But what was more disheartening was knowing that my family members who do have type 2 diabetes were having difficulty in obtaining the medications. We know that there have been shortages of the medications and have been, and they're ongoing for these medications. However, because of the number of people who do use them for either off-label indications or for weight loss, the people who really needed the medication to treat an actual disease state were having difficulty in finding the medications. And that's where my two roads led to the passion that I have for GLP-1s, making sure they're prescribed appropriately, making sure that people who actually need them have access to them, and have access to them in a timely manner.
The therapeutic scope of GLP-1 medications, we know it's expanding rapidly. Both Novo Nordisk and Eli Lilly, as we know, they're exploring new applications for GLP-1 drugs beyond diabetes and obesity. So I'd like you to elaborate on some of the more promising uses around GLP-1 medications, Dr. Treviño, such as sleep apnea, kidney disease. I've even read something on Alzheimer's. Maybe you can just share a bit more about that with us.
Right. So sleep apnea, Eli Lilly recently submitted information to the FDA for approval for the use of its drug tirzepatide in the use of obesity and sleep apnea. So for kidney disease, we know that decreasing hyperglycemia, elevated glucose levels, helps reduce damage to the arterioles in the kidneys that help filter blood and make urine. And so in doing that, in decreasing those elevated glucose levels, it helps protect those arterioles so that they can function the best that they can. Obviously, weight loss is affiliated with a whole lot of things. We know these medications are known for their weight loss, and weight loss can improve renal function. The other thing that these medications are found to do is decrease blood pressure by directly causing the blood vessels to dilate, so decreasing the stress on those blood vessels. And so this also helps decrease the progression of chronic kidney disease. Another way it works is it decreases urinary albumin excretion. That's a fancy way to say it decreases protein that the kidneys release. And again, this is a signal of kidney function. And by decreasing the amount of protein that is excreted in the urine, it shows improved kidney function. These medications, just as they are for sleep apnea, are also found to be anti-inflammatory, and they help with stress that's caused by oxidation within the body. So decreasing that oxidative stress and decreasing the inflammation helps protect the kidney and decrease inflammation and oxidative stress caused by those. The other thing these medications do is help improve the lipid profile. So by decreasing triglycerides and increasing HDL, the good cholesterol, those things are affiliated with cardiovascular disease. And by decreasing the amount of cardiovascular disease or cardiovascular disease risk, we're also improving kidney function. And the last is it has direct protective effects on the kidneys so that it helps the kidneys remain at their best utilization so that we don't see the degree of disease progression that we would if we didn't use these medications. The other thing that's important to note about kidney disease in particular with this medication is there's another class of medications called SGLT2 inhibitors that are also approved for this indication. And so it's going to be interesting to see how the GLP-1s play against the SGLT2s for these medications, for this disease state, considering the price difference for them. And as far as Alzheimer's, Steve, I was actually intrigued by Alzheimer's use in looking at these. And so again, it goes back to some of the same things that I just discussed with kidney disease. It reduces inflammation and oxidative stress, so it can protect the nerve cells from damage that's being caused by them. It improves insulin signaling in the brain, which is crucial for nerve cells to function appropriately and to survive. It also promotes the clearance of amyloid beta plaques, which are a hallmark of Alzheimer's disease, thus potentially slowing disease progression. It also reduces something fancy called tau hyperphosphorylation, which is another characteristic of Alzheimer's disease, in that these tau bodies assemble and cause tangles that can cause degeneration within the nerves, and that contributes to Alzheimer's. So by not allowing that to happen, then we can see the disease progress slow down. So those are exciting things that are on the way. We know they're also being looked at for lots of other reasons, which I'm sure we're probably going to talk about later, just to briefly touch on. But again, exciting things coming from this class of medications, and how we can utilize them to improve patients' lives.
We talk about prior authorization, step therapy. How do you see that management happening to ensure that these GLP-1 drugs are prescribed appropriately and that patients also at the same time receive the most cost-effective care?
Right. So those are the two main ways right now that health plans have to make sure that the medications are given appropriately. And in doing so, also hopefully reining in cost for the medications. So step therapy is the first one that I've seen both personally in the role that I had in my prior health plan, and then also in the family members that I have that are diabetic. Everybody who's diabetic should be started on metformin unless they have a contraindication to it. So most plans will require step-through therapy with metformin, showing that the person used it, that it has not helped their A1C get to a target goal, and therefore then there's other classes of medications that can be used. There's obviously older classes of medications that are also available for use that are generic over the, just like metformin is. And so, we see that most health plans will want those to probably be used first. But sometimes in diabetics, they're diagnosed late into their disease process because they didn't know. And so they do need, a multi-drug approach to help their disease state. And so that's where prior authorization comes into effect. And so they're going to want to see the step therapy step through, and then they're going to want to see, what other medications has the patient been on that they've tried and failed, or that they've tried and are still not at goal, to be able to say, yes, we believe and our formulary shows that this is appropriate, it's approved for the the patient can be approved for this medication. And here is the authorization to say, yes, the plan is approving you for this medication.
We know GLP-1s, red hot topic right now. A lot of the fire relates to the economic implications of these medications, as you know. Let's start with the high cost of GLP-1 drugs. It's been a major barrier for many patients. I've read somewhere it exceeds, in some cases, it exceeds $1,300 or more a month. So when we talk about cost for the average American and the impact on their wallet, what strategies are being implemented by health plans and then also policymakers to make these drugs more accessible and affordable, including touching into the underinsured and the economically disadvantaged?
Yeah, this is I think the biggest problem that we're seeing right now is how are health plans managing the cost of these medications, because we know they are costly. $1,300 is actually on the low end. Sometimes I've heard it's closer to $1,900 to $2,000 a month, depending on different circumstances. And so, some ways that health plans are looking at is by actually expanding insurance coverage. So allowing for certain medications in certain populations. So like I said, in my last role at Oscar, we were on the exchange, and the state of New York in particular said we had to cover weight loss medications. So that was something that was not required in other states. So in the state of New York, we had a list of medications that were approved, on formulary for patients to use to help with weight loss. And so by allowing things like that, state lawmakers are saying, hey, we know that there's this disease process, overweight and obesity. We know that that medications can help this. And not necessarily seeing the short-term benefits of the cost of it, because it is quite costly, but the long-term benefits of getting weight off people leads to a healthier population overall. And so trying to manage that through policy. Also, negotiating pricing through bulk purchasing agreements, rebates and discounts. That's what pharmacy benefit managers do all day, every day. There's obviously government subsidies and patient assistance programs. So for those people who may not have coverage, you can actually go on to the weight loss formulations of these medications in particular, and actually for the diabetic medications. And there are copay assistance cards to help with those things. Some of them for different medications are actually either a $0 or $25 copay for the medication, if you meet certain requirements. Unfortunately, it does not cover for patients who are on any kind of federal assistance, so it does not cover for Medicaid or Medicare. The other thing is encouraging generic and biosimilar development. So we know that for medications such as cancer medications or biologics that are used to treat autoimmune diseases, there is a plethora of biosimilars that come out to help decrease the cost and let patients have more access to these medications. Just last month, liraglutide was launched as a generic. It's a medication that was branded as Victoza or Saxenda. So it'll be interesting to see how this medication in particular, what kind of disruption does it do to the market for these medications, because it doesn't have the same amount of weight loss associated with it as semaglutide or tirzepatide, but it has the same the same general effects because it is a GLP-1.
Dr. Treviño, let's put on your prognosticator cap. So looking forward and in the spirit of transformation, what are your predictions for the future of GLP-1 medications over, say, the next 5 years? And then are there specific trends or breakthroughs that you think are going to shape the use in clinical practice and how health plans will approve them?
Well, based on what we're seeing now, Steve, we know that the use is going to expand. We know, again, we've talked about sleep apnea, we talked about kidney disease, we talked about Alzheimer's, but these medications are also being looked at for liver disease, Parkinson's disease, polycystic ovarian syndrome, cancer, and substance abuse disorders. So when you look at all of those things together, that's another large group of patients who could benefit from these medications if studies show them to be beneficial. So that just gives more of a boom to these medications being used or being recommended for more patients to have better outcomes in the long run. The biggest problem that we have right now is there's a handful of these medications and they're on a short supply. So obviously, as indications are approved, then the market demand will drive more as it is now. But it will also, hopefully, with the addition of further pharmaceutical companies entering the market with their formulations of these medications, it will also help with actual supply. So yes, we will have increased demand for these medications. I think nobody can argue that. Will we have the actual supply to meet that? And that's where we're, seeing, again, liraglutide just came out as a generic. What will that do to what we see right now with the GLP-1s? Oral medications that are being looked at. There is one oral medication formulation of this. It's only for diabetes. And so, other oral formulations will only help the market because some people just don't want to inject themselves. And so seeing those things will help us drive market demand, drive supply, will also help us decrease cost in the long run and make these drugs available, hopefully, to more people so that the people that actually need these medications can actually get them and gain benefit from them. So that's where I think that it's going to be more demand, hopefully more supply, and people will have what they need and have these tools available to them in a more ready manner.
And something tells me somehow, some way, we're going to hear Mark Cuban's name, perhaps, in all this.
I would not be surprised at all. I have not gone to look at his list to see if liraglutide is on there yet or not.
Well, with that, Dr. Treviño, I want to thank you for taking the time to share your insights, your thoughts, and really appreciate it. Looking forward to doing it soon.
Well, I appreciate it. This is a personal passion of mine, as we discussed at the beginning. So I keep my eye on this on a daily basis and appreciate the fact that you wanted to discuss it.
Our thanks to Dr. Ann Treviño for sharing her profound insights and expertise with us today. And for our listeners, thank you for joining us for this enlightening interview. And stay tuned for more of Lyric's thought leadership and conversations around the trends, challenges, technology, and opportunities that matter to you. Thanks for listening and sharing with others, and have a great day.